On the occasion of the World Health Day today, 7th April 2020, reminds us we are living through one of the most extraordinary threats to global health experienced in the past century. And it is only befitting that the World Health Day this year celebrates the central role played by nurses and midwives in the provision of healthcare services in all countries worldwide. I want to begin by sending warm thanks to all the dedicated, courageous health workers at the forefront of our responses to the crisis. These women and men are all heroes of our time, as they deserve our uncompromised support and admiration. Nurses attend to the sick, help develop preventive strategies, and contribute to emergency preparedness and response, patient safety, and many other areas. Midwives takes on the enormous responsibility of assisting women giving birth to our future generation. These women and men are animated today by a vision of a better, fairer health future for all, one in which they will not have to make the sacrifices they are making today. That is why thinking about prevention, sustainability, and intergenerational equity is so important even in the midst of this crisis. The continuing loss of biodiversity on a global scale represents both direct and indirect threats to our health and well-being. Biodiversity loss and ecosystem changes, including through land use change, habitat fragmentation and loss, and climate change, can increase the risk of disease emergencies and spread among people, animal, and other living species. Nature and the diversity of microorganisms, flora, and fauna is the source of medicine and antibiotics, and biodiversity loss will thus limit the discovery of potential treatments for many diseases and health problems. Biodiversity loss can also disrupt community traditions and livelihoods centered on traditional medicinal practices that use wild plants and animals, including many of the world's poor indigenous peoples and local communities. The One Health approach, which recognizes the intrinsic connection between human health, animal health, and resilience of nature, can help guide us towards the effective post-2020 global biodiversity framework and help us achieve the Sustainable Development Goals. It is my greatest hope that the fight against COVID-19 will soon be won and that we recover. We can pursue the opportunity to reimagine, transform our relationship with nature while promoting good and global health. Let us all work together to bring this crisis to an end and prevent similar catastrophic events in the future. We owe our brave nurses, midwives, and other health workers nothing less. Together, we will get through this and begin to build back better, with sustainability and resilience at the forefront of our work for transformative change.